Hello friends, I am back again to speak to you about epilepsy. Epilepsy is a very common disorder and it's very frightful too. Many of you must have seen or heard or seen in the movies how some people get a sudden attack of convulsion movements of the hands, they become unconscious. And so it's a very scary symptom. So, however, it is not so scary at all as it seems to be. And few interesting points as to how the words seizure come. Seizure means something to seize upon. In olden days, in the Greek days, they used to think that the gods used to descend from heaven, seize the human beings for a few minutes, and then go back. So this was the belief. Now we have come a long way from there, and now we know what is epilepsy and what is the cause. So what is epilepsy? Epilepsy is a recurrent attack of abnormal deranged electricity arising in the brain. See, brain is nothing but an electrical organ in a synchronized fashion. So whenever there is asynchrony or excessive discharge from either the whole or part of the brain, we get epilepsy. So recurrent attack of seizure is called epilepsy. And there are many types. For example, motor, which all of us are aware, this is a usual thing. However, there are many more things which can happen in one part of the body, one side only, or they may have just some jerky movements like this, or they may just drop, or they may have just some fluttering of eyelids. So these are the different types of epilepsy. So let us go into the causes. So it is again a myth that epilepsy is heritable. By and large, no. However, there are very minority a type of epilepsy which are transmitted hereditarily, but generally majority, more than 90%, no. And so other causes are in infections of the brain, some injury to the brain, some growth inside the brain, and some other electrolyte disturbances can cause transient epilepsy. Like for example, if the sodium becomes very low or too high, calcium drops, or the sugar is too low, too high, then these all lead to epilepsy. Okay. Now most important thing is what to do, what is the first aid. So commonly, unfortunately, this has been spread in the films too, that they all run and give a key. It's of no use, and I don't know why this has been propagated too much. Generally, what has to be done is the patient has to be made to lie down on the floor or on the bed and turn the patient to one side. That's all one needs to do. And if the patient is wearing any tight cloth, to be loosened, and if there may be some frothy secretion from the mouth, just turn the face to one side so that all the froth comes out. That is the idea. So never put a key. Most importantly, we must know what not to do. Many times, knowing what not to do is more important than knowing what to do. So do not force feed. That's the most dangerous thing to do. So to feed somebody when somebody is unconscious, the fluid can go directly to the lungs and it can be life-threatening. So best is do nothing, turn the patient to one side and face down. Things will settle automatically. Everything will be fine. So that is the first aid. So now causes we finish. Is it treatable? So again, it's a myth that once epilepsy it cannot be treated. No. 70% they can be treated very well. In fact, they can be cured almost completely. But patient has to be evaluated. MRI has to be done. EEG has to be done. It has to be figured out which type of epilepsy, what is the cause, and then it can be treated. Yes, there are a minority which do not respond to single drug. Then we resort to another drug, or sometimes some other measure needs to be taken, but generally out of 100, if you take all good measures, 90 to 95 will have very good response to therapy. So it's a good sign. It can be treated, so no need to despair. And then Another problem is the diet. So there is another myth that if we eat cold stuff, cold foods, then the fits may come. In that case, everybody in Russia should have a problem. That is not true. There is no restriction. Whatever the person is used to, let him or her have the same amount, same type of food. There is no need to change anything. And the other issue is we need to maintain, a patient with epilepsy need to maintain a healthy lifestyle. That means they have to eat on time, sleep on time, no alcohol, and stress has to be avoided. And generally, for example, if the patient is prescribed medication twice a day, then it is better that approximately medicine are taken at 12-hour gap, so that the whole 24 hours is covered. For example, if you take a medicine at 6 o'clock and then again 10 o'clock in the night, so the 24-hour equal cover doesn't happen. So approximately, let's say 6 and 6 or 7 and 7 or 8 and 8. So this has to be maintained. That will go a long way. And it is also important from the patient's perspective to maintain a diary. Okay, so diary of two things. One, they tend to forget whether medicine has been taken. So once a medicine is taken, a tick mark can be done. And second thing, the patient develops a recurrence also. So if there is a tick mark, then when they visit the doctor the next time, they can tell the doctor that these are the times it has happened, how it has happened, and then the medicine will be adjusted accordingly. Another important thing is regarding pregnancy. Can an epileptic patient become pregnant? Yes, surely, definitely, they can become pregnant. They can lead a normal life. But pregnancy has to be planned, so the doctor has to be told by the patient that I am planning to get pregnant, and so the doctor will adjust the medicines accordingly, and due precautions and folic acid will be given in advance so that the patient can have a smooth pregnancy, and both the pregnancy and childbirth can be a joyous experience rather than being an experience of stress. Okay, and next is what about medication and long-term side effects like kidney problem, liver problem, and another important query is regarding medicine and studies. No. Medicines, nowadays the medicines which you have are very safe. Of course there are side effects, there is no medicine without a side effect, but generally, the one or two major side effects are generally told upfront to the patients to be watchful of these side effects, and the patient also has to report back to the doctor immediately if there are any new symptoms. See, only at higher doses there can be some difficulty in learning or the patient can be drowsy. By and large, we don't reach that dose and we can maintain safely with lower doses of medicines. And generally, the performance in school is not affected by the medicines. However, the disease is not controlled, recurrent seizures, it can definitely affect the performance. So it is a constant feedback and a one-to-one relationship between the doctor and the epileptic patient, which goes a long way in smooth treatment of the epilepsy. Another important point is driving. So very often this question is asked, as per law, a patient is not supposed to drive for 1 year after the last epileptic attack, provided it's a recurrent seizure. For example, if the patient has had a low sugar and had a fit, then after a couple of weeks he can drive. But if a patient is an epileptic and he has had an attack and there is no precipitating cause, then it is advisable not to drive for 1 year. However, the rules vary from country to country. And once the patient is seizure free for 1 year, he and she can drive. Of course, some important things like they should eat on time, they should sleep on time, that's very important, and avoiding excessive colorful lights also is very crucial in the long-term management of epilepsy. So, to summarize, epilepsy is a common disease. It has varied causes like lack of blood supply or infection or tumor. By and large, it is eminently treatable. 70% do extremely well, remaining 20% do well with careful therapy and tailored treatment. They can have a normal life, they can get married, and generally there's no restriction in diet, and they should have a healthy, regular lifestyle. And there are mostly no long-term side effects of the medication. The modern medicines are much, much better now. And pregnancy can be a normal event in these people with due precautions taken. And there is restriction in driving, swimming, and alcohol is not allowed. Thank you.